Early diagnosis is of great importance in brain tumors, which are generally classified as benign and malignant. Since not every brain tumor has a lethal effect, correct intervention and early diagnosis are very important in curing tumors. Tumors can be brought under control thanks to early diagnosis and new treatment methods that have emerged with the development of medicine. Brain tumors result from cell abnormalities, such as tumors that form in different parts of the body. Cells develop just like living organisms. Growing and dying cells are replaced by new ones. In this regeneration stage, when the cells take on a different structure, excessive cell proliferation, or when the new cells do not die, these cells begin to become a mass. The exact cause of these masses, called tumors, is unknown. However, it is accepted that genetic factors and exposure to radiation have an important role in tumorigenesis. Although the factors that cause brain tumors are still being investigated, today it is known that some factors have an effect on tumor formation. These factors are genetic, exposure to radiation and various carcinogenic chemicals, various viruses, especially HIV infection, smoking, cell phone use one of the suspected reasons, though not proven yet. Brain tumor symptoms vary from patient to patient, depending on some factors. The location, size, growth rate, and type of the tumor cause changes in the symptoms. The emergence of symptoms is based on reasons such as the pressure of the tumor on the nerve endings and the accumulation of fluid in the brain by very large tumors. Since the brain is the organ that manages all the movements of the body, symptoms can be seen in different regions. Although very severe headache is characteristic with a brain tumor, the symptoms generally seen in patients are as follows: severe headache, fainting attacks resembling epileptic seizures, nausea and vomiting, balance and gait disorders, numbness in arms and legs, vision problems such as blurred and double vision, speech disorders, consciousness disorders, personality changes, slowing down in movement and facial expressions. Types of brain tumors. Brain tumors are classified according to their location and shape. The World Health Organization, who listed brain tumors under 7 main categories in 2016. There are more than 30 tumor types with different characteristics under these main categories. One of the most important reasons for this distinction is that not all tumors formed in the brain are related to the nervous system. Some tumors may arise from other abnormal cells, vessels, the lining of the brain, or from tumors in a different part of the body other than the brain. Brain tumors are basically divided into two as primary and secondary. Tumors that occur and spread anywhere in the brain tissue are called primary tumors. The most common types of primary tumors, which can be benign or malignant, include glioma and meningoma arising from glial cells, cancer cells seen in organs such as the stomach, lungs, and intestines of the body can reach the brain through blood vessels. New cancerous cells formed in the brain due to these cells are called secondary tumors. These cells are also called metastases. Benign tumors. Benign tumors are types of tumors that arise for reasons that do not originate from brain cells and do not contain cancer cells. In general, slowly growing benign tumors have clear boundaries. In this way, all or part of the brain tissue can be easily removed by surgical operation. When benign tumors, which do not usually spread to the surrounding tissues, reach very large sizes, they can put pressure on the nearby tissues and prevent the brain from performing some of its functions. Benign tumors, especially meningiomas, include dermoid and epidermoid tumors, colloid cyst, pituitary adenomas, neuromas, hemangioblastoma, and astrocytoma. Malignant tumors. Tumors. Malignant tumors that grow and spread rapidly are the main cause of brain cancer. Malignant tumors whose borders are not clearly known also damage the surrounding brain tissue, causing the brain to fail to function. It is not a preferred method to completely remove these tumors, which are formed by cells responsible for performing brain functions by surgical operations. Removing all of these cells means that brain activity is also lost. Malignant tumors can grow back after surgery. Glial tumors and metastatic brain cells are common among malignant tumors. Glial tumors, which are one of the most common brain tumors and cause cancer, multiply uncontrollably. As a result of this rapid growth, cancerous cells also affect the surrounding healthy cells. In this process, which is divided into Grade 1, Grade 2, Grade 3, and Grade 4, various treatment methods are applied to the patients. Metastatic cells, on the other hand, are formed by the spread of cancerous cells seen in a different part of the body other than the brain to the brain. Although metastases, which constitute approximately 10% of all brain tumors, may originate from different organs such as the lung, stomach, and pancreas, the source of these cancerous cells cannot be detected in some patients. How is it diagnosed? The diagnosis of brain tumor is made as a result of imaging methods, medical history of the patients, and neurological examination. In particular, magnetic resonance MR and brain tomography are the primary methods used during diagnosis. Angiography, radiography, CT, and biopsy are also performed in some cases. As a result of pathological examinations, a brain tumor is definitively diagnosed. Treatment methods. In the treatment of brain tumors, besides surgical operations, radiation therapy, radiation, and drug therapy, chemotherapy are also applied. In the selection of the right treatment method, the size, location, type of the tumor, and the condition of the patients are taken into consideration. Surgical operation. Surgery today. Very successful surgical operations are applied to remove some or all of the tumors. Surgical operations consist of biopsy and microsurgery performed with the aid of a microscope. Biopsy is performed with the help of a needle from a point close to the tumor, especially in order to learn the type of tumor. Microsurgery is usually applied to remove the entire tumor. Microsurgery method is preferred both to reduce the intracranial pressure and to eliminate the symptoms caused by the tumor. Radiotherapy. Radiotherapy, which is generally one of the preferred methods in malignant tumors, includes the application of X-rays or gamma rays to the tumor area at certain intervals. The aim of radiation therapy, which is applied without damaging the healthy tissues around the tumors, is to prevent the growth of cells or to completely destroy these cells. Chemotherapy. Within the scope of chemotherapy, it is aimed to prevent the proliferation of cells with drugs given to patients at certain intervals. Chemotherapy, which is widely applied to cancerous and malignant tumors, generally prolongs the life expectancy of patients. Who is more likely to have a brain tumor? Brain tumor can be seen at any age from birth. However, it is more common in individuals over 70 years of age and in children younger than 10 years old. In addition to age, gender and being a Caucasian are also considered risk factors. Brain tumor is more common in men than women. Those with a family history of a brain tumor are also at higher risk of developing the tumor. Is every headache a symptom of a brain tumor? No. Headaches have a wide variety of causes, such as migraines, extreme stress, or high blood pressure. Headache, which is shown as a symptom of a brain tumor, is very severe, sudden, and uncontrollable. This severe pain can also be a sign of cerebral hemorrhage. In some cases, although the pain is non-violent, it persists for a very long time. In these cases, it is necessary to consult a specialist physician for examination. Should all brain tumors be removed? No. For some benign or congenital tumors, follow-up without surgery may be sufficient. It is sufficient to follow these tumors at regular intervals. In malignant tumors, the appropriate treatment method must be applied. How common is a brain tumor? The prediction of experts for brain tumor, which is seen as 5/100,000ths today, is that the number of patients will increase in the coming years. Among the important reasons for this are the rapid increase in elderly individuals and the development of imaging techniques. Don't forget to like the channel and subscribe.